Welcome to How to Give an Injection for Alameda County's Pod Operations Vaccination Training. As a trained medical worker in a point of dispensing operations team, you'll be responsible for administering vaccines during a public health emergency. Your role may be the central operation in such an emergency. This video will help you quickly review vaccination preparation and administering techniques. Part 1. Overview. There are 4 common ways to administer vaccines: intramuscular, subcutaneous, oral, and nasal. The first 2, intramuscular and subcutaneous, require you to inject the vaccine by penetrating the skin with a needle. These can be difficult and time-consuming, so performing them correctly is important. Some emergencies require a rapid response. In a time-critical event, a quick response time helps to stop the spread of disease. The faster you can inject people, the more lives can be saved. This is the #1 rule of pod operation. Speed is just as important as the injection process. Speed saves lives. But safety is also a consideration. First, work safely, and second, work efficiently. If you do, you'll be performing at an appropriate speed. Never rush. Oral and nasal vaccine administering is much easier and typically much faster. When you arrive at your vaccination station, you'll already have registered, been briefed, trained, and received vaccine yourself. The first thing you should do is make sure you know the vaccination station and your supplies. Alameda County has a basic model that's used for every vaccination station. Your station will probably already be set up when you arrive. But if it isn't, setup is quick and easy by following the setup book. For more information on vaccination station setup, see the video in this series explaining it in detail. Using this standard vaccination station design should become second nature to you. Note: sharps containers are placed to minimize the time that used needles are in the open. There are 2 layers of sterile cloths on the table. If you soil the top one, you can switch it without pulling up the entire bottom tablecloth. Be familiar with your personal protective equipment, or PPE. Depending on the emergency, you may need to wear gloves, a surgical mask, fitted N95 mask, gown, or other type of equipment. If gloves are a part of your PPE, they should be changed between each vaccination. Remember not to touch your face with your hands. And if latex gloves are used, make sure the public is aware the vaccination site is not a latex-free zone. If you don't have gloves, always wash your hands with soap and water or an alcohol-based gel between each vaccination. Pathogens can be transmitted from an infectious person to a susceptible non-immune person through contaminated equipment or medications. If it's a contagious event, instruct clients to cover their coughs. If necessary, clients should wear a mask. Make sure you keep track of your supplies. Vaccines are temperature controlled and will come from refrigerated storage. When they arrive at your station, they should be kept in a cooler if not used immediately. In general, handle all vaccines and supplies in a manner that prevents microbial contamination. Part 2. Vaccine preparation. Injectable vaccines come in 2 forms: ready-to-use and reconstituted. Ready-to-use vaccines come in liquid form and are packaged in vials or pre-filled syringes. A pre-filled syringe contains vaccine but does not come with a needle. A vial may contain a single dose or a multi-dose vaccine and must be drawn into a syringe. Always use a sterile needle and syringe when using a multi-dose vial. Never use a bent needle, and never leave a needle inserted in a vial. Microorganisms can enter a multi-dose vial and contaminate the fluid when a needle remains inserted, so remove the syringe promptly. Before you draw up a vaccine, verify the expiration date. Dates can be written different ways: day first, month first, or just month and year. The year will always be the final number. If an expiration only includes the month and not the day, then the vaccine expires the final day of the month. Never draw a vaccine from a vial if the vial is uncapped, or has a wet label. Set that particular vial aside and select another vial, but do not throw away the vaccine vial. After the dispensing session is complete, you'll be asked to account for every dose and every vial through the inventory management system. Step 1. Prepare to draw the vaccine. Vaccine should be drawn up in a designated clean medication preparation area. Wash your hands. Select the appropriate syringe and needle for the vaccine you will administer. Have alcohol pads or cotton balls moistened with alcohol available. When drawing up the ready-to-use vaccine, remove the vial cap and wipe the rubber stopper off with an alcohol pad. Hold the vial on a flat surface, pushing the needle straight into the center of the rubber stopper. When using a single-dose vial, draw up the entire vaccine into the syringe. For a multi-dose vial, carefully measure the full single dose out of the vial. Always check the syringe and the vial to ensure that you have drawn the appropriate dosage. Carefully remove the needle from the vial, recap the needle, place the syringe on a labeled tray or clearly mark the syringe. Reconstituted vaccines come in freeze-dried or powdered forms and will need to be reconstituted with a diluent prior to drawing the vaccine into the syringe. Diluent is a more medically accepted version of the common term dilutant. Vaccine manufacturers provide a specific diluent for each vaccine. Caution: the vaccine will become unusable if a diluent is switched or substituted with saline or sterile water. To begin the reconstitution process, you'll need to draw the diluent. Remove the diluent vial cap and wipe the rubber stopper off with an alcohol pad. Hold the vial on a flat surface, pushing the needle straight into the center of the rubber stopper. Withdraw the diluent into the syringe by gently pulling up on the plunger. Once the diluent is drawn, you'll inject it into the vial containing freeze-dried vaccine in the form of pellets or powder. Remove the vial cap and wipe the rubber stopper off with an alcohol pad. Hold the vial on a flat surface, pushing the needle straight into the center of the rubber stopper. Push down on the syringe plunger, injecting diluent into the vaccine vial. Begin mixing the vaccine with the diluent by agitating the vial. When properly mixed, the liquid will have a consistent appearance throughout, and there should not be any sign of particulate matter. Now load the syringe just as we did with the ready-to-use vaccine. Just to review, when using a single-dose vial, draw up the entire vaccine into the syringe. For a multi-dose vial, carefully measure the single dose out of the vial. Always check the syringe and vial to ensure you've drawn the appropriate dosage. Carefully remove the needle from the vial. Recap the needle, placing the syringe on a labeled tray, or clearly mark the syringe. Note, once vaccines are reconstituted, they must be kept refrigerated according to cold chain requirements. For specifics on cold chain requirements, check packaging. Part 3. Needle selection and injection. Selecting the proper needle size is dependent on the injection site and the age and body mass of the client. A scale should be available within the vaccination dispensing area to assist you in proper needle selection. There are 2 types of vaccination injections: subcutaneous, or SC, and intramuscular, or IM. The best protection in a public health emergency response is to assure proper technique and route in vaccine dispensing. Giving vaccines the right way gives the best protection against disease. In a subcutaneous injection, the vaccine is injected into the fatty tissue just under the skin. When administering this type of vaccine, you'll need a 23 to 25 gauge needle, which is 5/8 inches in length for all age groups. It's always the same needle length, but the shots will be given in different locations on the body. For infants under the age of 1, a good place to give the subcutaneous injection is the fatty tissue over the vastus lateralis muscle. That's the large muscle on the front of the thigh. For children over the age of 1, adolescents, and adults, either the fatty tissue of the upper outer arm over the tricep or the vastus lateralis can be used as injection sites. When administering an injection, first select the injection site, Then use this little trick from the Oakland Fire Department. Take an adhesive bandage and stick half of it to the skin so that it will cover the injection site when fully applied. This clearly marks the injection site and avoids any risk of sterilizing the spot and then missing it when you turn back to give the injection. Now for a subcutaneous injection. Begin by cleaning the injection site. Place an alcohol pad at the center of the injection site and wipe in a spiral movement, moving away from the center. Allow the alcohol to dry for several seconds before administering the vaccine. Alcohol can sting if it gets into an injection. Throw away used alcohol pads in a medical waste container. Then, with the thumb and forefinger of your non-dominant hand, pinch up the fatty tissue of the injection site. With your dominant hand, insert the needle at a 45-degree angle to the skin. Insert the entire needle. Push down on the plunger and inject all of the syringe contents. Do not aspirate. Remove the needle gently, in a smooth motion and at the same angle from the injection site. If you notice bleeding, you may apply light pressure for several seconds with gauze or a dry cotton ball before covering with the adhesive bandage. Once you've removed the needle from the injection site, place the uncapped needle and used syringe directly into a sharps container. Do not recap the needle. Do not set the needle down at any point, and never try to separate the needle from the syringe. Watch the needle continuously until it's in the container. The CDC describes a safe injection as one that does not harm the recipient, does not expose the provider to any avoidable risks, and does not result in waste that is dangerous for the community. An intramuscular, or IM injection, is done directly into a muscle. Most vaccines are given intramuscularly. When administering this type of vaccine, you'll need a 22 to 25 gauge needle, which will vary in length based on age and body mass. For the first 28 days of a newborn's life, the vastus lateralis muscle is a good place to do intramuscular injections with a 5/8 inch needle. An infant under the age of 1 will also receive the IM injection in the vastus lateralis muscle, but with a 1-inch needle. For toddlers 1 to 2 years in age, the vaccine can be administered in either the vastus lateralis with a 1 to 1 1/4 inch needle, or the deltoid muscle of the arm with a 5/8 to 1 inch needle. Children and teens ages 13 to 18 years old may receive the IM injection either in the deltoid muscle of the arm with a 5/8 to 1 inch needle, or in the vastus lateralis muscle with a 1 1/4 inch needle. Adults over the age of 18 should receive all IM shots in the deltoid muscle of the arm. Adults over the age of 18 weighing less than 130 pounds will need a 5/8 to 1 inch needle. Females weighing between 130 to 200 pounds and males weighing 130 to 260 pounds will need a 1 to 1 1/2 inch needle. All females weighing more than 200 pounds and men weighing more than 260 pounds will need a 1 1/2 inch needle. When administering an intramuscular injection, begin by selecting the injection site and pre-apply one side of the bandage using what's referred to now as the bandage marks the spot technique. Next, as with the subcutaneous injection, clean the site by placing an alcohol pad at the center and wiping outward in a spiral movement. Allow the alcohol to dry for several seconds and throw away the used alcohol pad. Next, we recommend using the Z-Track method to ensure a good dosing. Tight muscles, especially in athletic arms, can sometimes squirt the vaccine right back out of the injection site if you don't Z-Track. To Z-Track, all you have to do is slide the skin and subcutaneous tissue to the side, perform the injection, and then let go of the skin and it will snap back, displacing the puncture in the skin from the puncture in the muscle. Also, according to the CDC, it's not necessary to aspirate when doing an intramuscular injection because no large blood vessels exist at the recommended injection sites. Grasp the syringe like a dart, holding the needle 1 inch from the injection site at a 90-degree angle to the muscle. With the non-dominant hand, displace the skin by pulling it to the side an inch or so. Now fully insert the needle, keeping it at a 90-degree angle. Squeeze the plunger to inject the entire contents of the syringe. Remove the needle gently in a smooth motion at the same angle as insertion, and then release the skin, letting it slide back into place. This will Z-track the injection and keep the vaccine in the muscle where it belongs. If you notice bleeding, you may apply light pressure for several seconds with gauze or a dry cotton ball before covering with the adhesive bandage. Once you've removed the needle from the injection site, place the uncapped needle and used syringe directly into a sharps container. Once again, do not recap the needle, do not set the needle down at any point, never try to separate the needle from the syringe, and watch the needle continuously until it's safely in the container. Repeating this process a few times, carefully following all the technical instructions, should make it a routine that will improve your safety and efficiency. The other two types of vaccination, oral and nasal, are much easier, but there are a few things to keep in mind. Oral medications come in either liquid or pill form. Pills are typically self-administered, so we won't address them here. For oral vaccines, you may need to constitute them with diluent similar to injectables. Oral vaccine is typically administered with a disposable oral syringe. To administer an oral liquid vaccine, make sure the recipient is stationary and upright. Place the syringe into the mouth along one side and toward the back, but not so far back that you cause gagging. Squeeze the syringe in one quick, smooth motion to empty the contents into the back of the mouth, where it will be automatically swallowed. Babies especially may tend to spit vaccines back up if administered too far forward on the tongue. Giving nasal vaccines is also fairly easy. The nasal syringe is set up with a small plastic clip that allows you to easily administer half a dose into each nostril. Place the nasal syringe with the tip inside the nostril and give the plunger a quick smooth squeeze. The clip will stop the plunger halfway. Remove the syringe from one nostril, remove the clip, then place the syringe into the opening of the other nostril and squeeze the rest of the dosage into it. People sometimes have a tendency to snort the vaccine to help draw it in, but this is not necessary as long as the vaccine sprays past the nostril into the mucous membranes. After use, both oral and nasal syringes should immediately be thrown into medical waste containers. Part 4. Emergency Vaccination Pods. Unlike other public health services, emergency vaccination will focus on mass care rather than individualized care. Many of you are experienced health professionals whose instincts may draw you towards reassuring bedside conversation. But remember, speed equals survival. So everyone must use their best judgment to expedite dispensing of vaccinations while maintaining a reasonable standard of interaction with the public. The number one rule to remember in a time-critical emergency is be reassuring and supportive, but always keep the line moving. Avoid chit-chat that can cause bottlenecks. Each vaccination pod should have a specified target throughput level, the rate of dispensing that your pod is expected to achieve. Meeting or beating that throughput level will save lives. Be aware injection rates per hour are significantly lower when administering to children. Families with children should be directed to a pediatric vaccination area where adults and children can be processed together. Children may experience needle anxiety. In such cases, you may suggest that parents hold the child on their lap, or that the child repeat a word with you at the time of the injection, like bunny rabbit, or that the child blows away the pain after the needle has been removed. Remember to keep the line moving. You're performing mass care in an emergency response. Speed equals survival. And although crying or fussiness may result, it need not slow down the line. Remember, your skill administering vaccines is one of the most valuable and critical roles in an emergency. Performing it quickly and efficiently using these guidelines is the best way to save lives. And as with all vaccines and medications, make sure to follow instructions and advice of medical authorities. We hope this training series on how to administer vaccines will assist you in performing your duties and saving lives during a public health emergency. Thank you for your service. If you have any additional questions, please ask your supervisor or contact the Alameda County Public Health Department. This POD video training series is brought to you by the Alameda County Public Health Department, Office of Public Health Emergency Preparedness, in collaboration with Applied Creative Training, Inc.